Good afternoon, everyone. Welcome once again to MGM Healthcare's Facebook Live Kids Health Talk, a series of talks once a week from MGM Children's, the Department of Pediatrics and Neonatology at MGM Healthcare, Chennai. We have these talks once a week from pediatricians, pediatric super specialists, and related specialists on topics about children and children's health that we think that parents will find useful. These talks continue to be on Facebook and on YouTube for you to access whenever you need to. Please encourage any of your family members you think who will benefit from this to take a look at them. Thank you for your support so far for all the talks we have done. If you have any questions during the talk or when you watch them, please enter it into the chat box and we will be happy to get back to you with the answers. Today, it is our honor to have with us Dr. Ratna Prabhu.
Thank you.
Dr. Ratna Prabhu is a senior pediatric pedodontist. A pedodontist is a pediatric dentist, a dentist who specializes in looking at children's teeth. So he is here with us today because we know that as parents and families, there are always many questions about children's teeth, about many problems with children's teeth and how to look after children's teeth that parents have. And he's here to answer those questions. And as you know, a lot more children are developing caries. A lot more children at younger ages are going in for root canal treatments. So how do we look after our children's teeth becomes more relevant at this time. Without any further ado, welcome Dr. Ratna Prabhu.
Thank you, Nisha.
So let us go on with our talk. Dr. Ratna Prabhu, you start off by giving us an overview of how children's teeth develop from the time when they're in the mother's uterus as a fetus to the time when they're born and after as they grow older. Could you tell us how children's teeth develop?
First of all, I must congratulate all the mothers or the parents as such to be in the next limelight of going to a phase where in the best part of life they're going to go through. So generally, what we generally say is the teeth starts developing in the intrauterine life itself within the mother's womb by about 12 to 14 weeks. So we need to take care of it, not at that time, but we need to think how to capable of see to that the child is much more healthier. For that, we need to be healthier, and mother need to have a good oral hygiene also. They should not have any cavities or any infection during the pregnancy, so that they have a good, healthier life. And once the child is developed and a good, healthier child has been delivered, then that's the best part of life they're going to see. And I think both the child as well as the mother will have a best smile, or the parents will have the best smile in the world at the time. So they should be happy, and that's the way start welcoming the child with a happy face and a happy smile. So that is what is more important. So once the teeth starts developing at the age of 12, but all takes place within the bone. So that is what happens, and the teeth starts developing from the age into the oral cavity, or mother starts seeing it only from the age of 6 to 8 months. So until that time, the child will have only the lower and upper gum pads, or only the ridges is going to be there. We call them as a gum pads. So that is the way the child starts developing. Then what happens is, after some time, or some of the children where there's going to be some amount of, we'll have natal or neonatal teeth. Natal teeth are nothing but, as soon as the child is born, the child will be born with the teeth. It is nothing but a herniation of the tooth, which is the milk teeth supposed to come at the age of 6 to 8 months, comes as soon as the child is born or within the first 15 days. That is called as a neonatal tooth. So I think the mother should not get panicky, but it is a new thing. So it's going to have, there's nothing sentimental value and all those things. We need to just take the challenge and say how it is. The first thing is they will have the fear of feeding, whether it is going to be hindering in the feeding aspect, whether it's going to be child is going to have difficulty or the mother is going to have difficulty, and chance of child swallowing is going to be there. So best thing is to get reassured from the gynecologist as well as with the pediatrician, and see the dentist. Probably if the teeth is going to be sound enough, we might not need to interfere at all. We just need to reinforce that the child is going to be in the right space and they're happy, to it off. Just that reassurance must be enough. But in case the teeth is still going to be moving, or it is dangling, and the fear of it is going to get ingested or getting aspirated, then we need to intervene. So first 15 days, best thing is to intervene as soon as the tooth is going to be, chance of aspiration is going to be there, or it is going to get laceration of the tongue or the lip is going to take place. That time it is just going to be a simple procedure of, probably we need to just remove the teeth with local anesthetic, where probably we need to just see the blood picture, if the bleeding time and clotting time or a PTPT is all right, and probably supplement with vitamin K also. Once that has been done along with the support of the pediatrician, then we can just remove it. It's only a daycare measure where it's going to take about 3 to 5 minutes time. Once it is done, probably the mother can feed the child after about 10-15 minutes time. So both of them are going to be happier, and that's not going to be any difficulty as such. But tooth is going to be firm, best is to leave it off, because anyway the tooth is going to be there after about 4 to 6 months time. So just a reassurance is going to be enough, so that the child is going to be having a good set of teeth, not that one is going to be lesser. Even if the tooth is going to be removed, it is going to be compensated once the permanent teeth are going to erupt into the oral cavity. So this is the way where the first tooth start developing.
Thank you, Dr. Ratna Prabhu. Thank you for telling us how to manage natal and neonatal teeth. That is often when babies are born, sometimes when babies are born, they have this, and it causes mothers distress and families distress to see these teeth. So thank you for giving us an overview on how to manage this. As a next question, the next common concern of families is how long can they wait for the appearance of the first tooth? Families get anxious when the teeth don't start developing. So how long, what is normal, and how long can they wait?
There is it's a range. It does not come on the particular date or a time and everything. It's a range. It comes to the age of 6 to 8 months generally, but even it can come about 2, 3, 4 months before or after also. So nothing to get worked up, as long as there's going to be some amount of tooth development and the tooth bud prominence is going to be there. And once the child starts suckling the mother's breast and starts drinking milk, that physiotherapeutic effect is enough for the tooth to get developed normally. It not only the tooth develops, even the jaw, the mandible and the maxilla, the upper jaw and the lower jaw develops, and then the child starts breathing through the nose. That's one of the main aspect of feeding the child the breast milk or the bottled milk, preferably breast milk till the age of 6 months, so that the child starts breathing through the nose, so that the patency is maintained and they don't become a mouth breathers. All those things does not happen. So generally what happens is, after about 6 months to 8 months, the first teeth comes. Only the lower front teeth comes. So that once that comes, then probably you need to start as soon. The next thing they will ask is when to start brushing. So I prefer the child to be starting to brush from the age of 6 to 8 months, as soon as the first tooth comes. Nothing, just we need not do the regular brushing. Probably you can take a wet wipe or a turkey towel napkin, dip in drinking water, and then clean it up after every meal. So I'll prefer the teeth to be cleaned up as soon as the child starts finishing their meal, whatever they're going to take it. So the first thing is they will ask us, how often do we need to clean it up, or how long should we do the mother's milk or the bottled milk? I'll prefer till the age of 6, it is feeding at will. That is, feeding at will is nothing but whenever the child is hungry, you can start giving it. Once the child's teeth starts coming, then it should become, by about 6 to 8 months, the pediatrician and the mothers and the parents would have told to start having supplementary food also. That means the frequency of eating is going to be lesser. The frequency between every meal is going to be longer. So that is going to be the one thing. When they start eating properly, then they should start drinking whatever they eat, and everything should be done. And that is feeding on demand. When the child is hungry, you should start giving it, rather than child is whenever they want, not at will. So that is what is more important. So that is where the child's development and their homogeneous teeth development is going to take place as such. And once about 6 to 8 months time, the upper teeth starts coming at the age of 8 to 10 months, and the back teeth or the molars comes at the age of within about 24 to 36 months. You have the complete dentition of, we have about 2 sets of teeth. One is the deciduous teeth or the milk teeth. That's a set of 20. The upper jaw is going to be about 10, and the lower jaw are going to be having another 10. So at about 2.5, 3, the full dentition is going to be developed. So that is what we say, and it is called as milk teeth. It is nothing but not that it is milky white, and the color of the hue is going to be as that of the milk. So that is why we call it the milky teeth, and as well as we can say it as, because the child is taking milk, it is milk teeth or pal pallu, we say it in Tamil or colloquially. So that is what is the crux of the matter is. So until the best thing is, because they are going to be transitional from milk or liquid to solid, semi-solids and solids. This is a precarious time where if it is going to be guided properly, the child is going to having a good set of teeth, and the deciduous teeth as such, or the milk teeth, there are about 3 or 4 function of it. First is the smile or the aesthetic. The second one is mastication or eating. The other thing is phonation, or how to speak. Speech is going to be there. They're not going to be lisping, and the pronunciation of words, because they start developing till the age of 2.5, 3. The child starts developing of how to speak, and the pronunciation is going to be much more, clarity is going to come slowly. So that is, these are the 3. And the fourth, not but the least, is it acts like a space maintainer. It like a precursor waiting for the next teeth to come. So that is what is going to happen. So all the 20 teeth are going to fall, not at that any given point, but at a range of 6 to 12 years of age. So that is what is the function of a deciduous dentition, how to keep it. So brushing is one thing, we need to start doing it twice a day, morning once and evening one, at least for sure. And after every meal, preferably goggling.
So, Dr. Ratna Prabhu, thank you for that answer. Can you go and tell us in some more detail about, so care of teeth, as you say, involves 2 parts, as I understand. One is what you feed the child, and the other is how to brush. So in what you feed, you talked about breastfeeding babies and how to look after them. Can you tell us about older children and how to feed, how to feed older children?
That's a question where every parent is going to ask, and then it's going to be, only thing is, for feeding and for dentition, the information they get from everywhere is quite enormous, and nothing is wrong, nothing is right. So we need to be correct according to our own child. The best dictum, what I will say is, only the child should start eating only when the child is hungry, not the time bound one. That is one thing. And the child should not keep eating more than about 20 minutes to 30 minutes. 20 minutes is the maximum time, because the salivary center is going to be stimulated afterwards, and the child not going to eat. That is one thing. And food as such should be, nothing should be sticky first. Start drinking water, then start taking food. Starting and ending with a sticky food or a sweet should be avoided. Best thing is to start giving something fibrous in the last, so that any sticky food is going to get cleansed off on its own. Children are children, they're not going to listen to us of brushing. Till the age of 4 to 6, we need to start brushing as such. They will not have the dexterity to brush. So best thing is to start brushing twice a day minimum, and the night. And with the advent of TV and cell phone and our YouTube, everything, the child is not going to sleep till the age of 12, till about 11 or 12 or even 1. Probably the mother is going to sleep off before the child is going to sleep. So that child is going to have something in the mouth. So best thing is, as soon as the child finishes a dinner or the last meal, thing is to brush it. As soon as the child washes his hand, and the child needs to brush. And I'll prefer the mother to brush along with the child, so that it's like an habit. It is only, habit is nothing but it is an imitation. What the mother does, or the parent does, or the grandparent do it. I will not prefer to do it in the restroom. I'll prefer the child to be along with the parents in the hall or wherever we are going to be there, so that they know how to go about doing it. And then it should be a fun rather than becoming a punishment. Go there, do something and come back. It should not be the case. If that is going to happen, then it is a good thing. The other thing generally they ask is, what paste? Any paste is a good paste. They say fluoridated. Okay, very good, fluoridated paste is there. But no more than the paste, it is the mechanical way of you brushing it. How you cleanse your teeth is more important. We need not keep it shiny. We need to clean it up and keep it spick and span. That is what is more. No food particle good should get stuck over there. That should be the aim, rather than keeping it shiny. No, the teeth color is not going to change much. So what we generally say is, how do you clean your comb? The lower teeth should be coming from back, the bottom to up, upper teeth from the top to bottom, and only the biting surface should be to and fro. It is not like shoe polishing where we keep it spick and span or shiny. It should be spick and span rather. So that is what is important. And generally what they ask is, the child generally swallows. We all have swallowed the paste as such. So nothing wrong in swallowing the paste. So nothing, the maximum size of a toothpaste is about 200 grams. So even if the child is going to inadvertently swallow the full paste of, maximum is going to have diarrhea. Nothing is going to happen. It is not going to have much of fluoride toxicity, because even if the full fluoride has been consumed, also fluoride is below the toxic level. So we do not get worked up. That is one thing. And generally, the child does not have the capacity to goggle and spit it. They have a tendency of swallowing it till the age of 6 to 7. So do not get worked up. They will swallow the whatever you are going to give, even if you're going to ask them to swallow or to goggle, till the age of 6 to 7. So best time is to start brushing. Do not get worked up, and don't compartmentalize or reduce the paste as such. Paste is more like a foaming agent. It is only the brushing technique which is more going to be of more use than the paste as such.
Thank you very much,
And
Dr.
no
Ratna Prabhu.
mouthwash till the age of 6 to 12. Okay.
Thank you very much, Dr. Ratna Prabhu. So to summarize, it seems that you, please correct me if I've got this wrong, but from the age of 6 months, you use a small, like a towel, to wipe the child's gums. Then as the child grows older, children have to be supervised and brushed in twice a day till the age of 6 years. And toothpaste does not matter. And a lot of children swallow toothpaste, it doesn't matter.
Good.
But they need to keep brushing and make it a family thing and not a stressful event. And
It's
so that
not,
it becomes
it's not a
practice.
punishment as such.
Yeah.
It
And
should be a deed
you
where
can
it can
use
be done.
mouthwash after the age of?
Till the age of 6, or because they're not going to swallow much. So I will not prefer any mouthwash as such. I'll prefer it only after about 8 or 12 years. So preferably to avoid mouthwash as much as possible, because it has got, it will change the oral commensal, the good bacteria, the bad bacteria, whatever is there in the mouth. It is going to change, and the child is going to have a tendency to swallow also. So even the intestinal commensal are going to get altered. So preferably no mouthwash till the age of 6, or until they're able to goggle and spit it off on their own.
Okay. Thank you very much, Dr. Ratna Prabhu.
Welcome.
Going forward to the next question. So do children need regular dental visits?
I think it should be a regular dental visit. It should be more of a healthy baby clinic, where they just walk in and say, get reassured that their teeth are quite all right, healthy and healthy, so that it's more of a reassurance that they are on the right track. So we need not go for finding fault and saying that it's going to be pain. Only if there is going to be pain, you should see a dentist. So it's always better to preempt the problem. Best thing is to go as soon as the first tooth erupts, about the 6 to 8 months time, or at least the first birthday. Then every 6 months, just to go and say hello. That's what. So that it has been, the child is introduced to dentistry in a pleasant manner. So anything to be done, it is going to be where the pain is not going to be there. It is going to be much more easier for the patient or the child to accept the procedure. So it is not a fearful place or a factor to be dealt with as such. So I prefer every 6 months after the first tooth, or at least after the first birthday. And once they start doing it, I don't think they are going to problem. In that, we can also preempt the problem of any difficulty in any teeth cavities are going to be there, or is there going to be any malalignment. We can just preempt it. We are not going to straight away say that we are going to straight away remove all the malalignment, but probably the intensity can be reduced. So we are going to just probably guiding the eruption rather than correcting the eruption. There's a lot of difference between guiding and correcting. Correcting is we have done something wrong, then we are going to correct it. So there's going to be some amount of leftovers. If it is going to be guiding, we are going to guide the tooth or the dentition and the jaw, everything in the right physiological or the normal growth and development of the child.
Thank you, Dr. Ratna Prabhu. So that's good to know that children need regular healthy dental visits, just so that these may prevent complication that they can be corrected earlier. That's good to know. Going on for the next question. So we often hear of lots of children at very young ages going in for root canal. This is because they all have extensive caries. Now, can you tell our families what is caries? What causes caries in children?
Caries is nothing but it is a tool. They can a colloquial term or a layman term for better understanding. I don't want to go into the scientific aspect of it. It is more of the food particle getting stuck over there, and we call it a decay. Why it happens is there should be three things. One is the tooth should be there for decay to come. The other thing is food particle or substrate or food particle should be there. And there are a lot of good bacteria and bad bacteria in the mouth. So any food particle getting stuck in the mouth more than about 20 minutes, that is going to start putrefying. Once the microorganisms are going to start eating on it, and they're going to excrete some amount of excreta, that is going to be slightly acidic. It is going to just roughen up the enamel, so that is like enamel is just like any tile or something, that there is no blood supply towards it. So once that is getting roughened up, the food particle are going to get stuck further, and the disintegration of the enamel is going to take place. This is what is called as in the scientific term as caries, or we can say it as cavity or decay. So it is only disintegration of the enamel. As such, the teeth has got three layers. One is the enamel, which is the outer layer, which is what we see. The other one, the next one is below it is dentine. It has got a lot of dentinal tubules. And the third one is the pulp, where the blood supply and the nerve supply is going to be there. Until the teeth is going to be there, or the cavity is going to be there in the enamel, the child is going to have, other than discoloration, the teeth is not going to have any pain or discomfort. Once it is going to go, the cavity exposure is going to take place, so the cavity is going to going till the dentine, then little bit of sensitiveness is going to come. The child as such will not know to say whether the sensitiveness and all those things. By the time they are able to say it is going to be sensitive or pain, damage is done, it would have gone towards the pulp. Once it goes to the pulp, then it starts paining. So that is where we need to go in for root canal or pulpectomy in deciduous teeth, or pulpotomy on all the pulp therapy needs to be done. Okay. But what generally happens is the child starts saying pain in the night, because the child is going to sleep. The pressure is going to be slightly more on the tooth or the pulp. It is a closed chamber. Once there's going to be some amount of inflammation, the pain is going to be mimicking. When the child sits up, it is not going to be there. And when the child gets up, this child might not say about anything about pain. So we will conveniently forget about it or ignore it. But after some time, it starts, repetition is going to be there much more faster, or very often frequency is going to be there. So anytime if there's going to be pain, that means damage has already been done. So better to address to the teeth, whether it is going to be pulp therapy or it is going to be restoration, needs to be done as soon as possible. So that any teeth should be there until it's supposed to be there, or it should serve the purpose of the time and tide. So if it is going to be taken care, if it is going to fall off before it, that is where your malalignment or eating, everything is going to be difficult. So the child is going to conveniently avoid certain food and start taking something. So that is going to tell on the child's general health. The growth is going to be difficult, the swallowing, as well as they are going to have constipation or difficulty in their eating, as well as their regular diet is going to get affected. So I will prefer, once the teeth is going to be taken care and the child is going to chew nicely, the digestion is going to take place in the oral cavity. It starts in the oral cavity, not in the mouth itself, not in the stomach. Generally, but they take, that's why they say you need to eat nicely, you need to chew properly. Once the saliva has got certain amount of enzymes where it emulsifies along with the food particles or the food, then it starts the digestion starts in the oral cavity itself. Then it goes into the stomach. Then the stomach starts its own function. Otherwise, we are going to skip first step. Then it is going to land up with other problems as such.
So thank you, Dr. Prabhu. So it tells us a lot about caries. Now, how does one manage caries? Suppose you have caries in milk teeth versus and permanent teeth. How do dentists manage this? How does a pediatric dentist manage this?
Milk teeth, it depends on the age of the child. If the child is going to have it at the age of 1.5, 2, that means the longevity of the tooth, even though the teeth is going to be a long-term deciduous teeth, or it is going to be falling off anytime, but it's not going to fall off next week or next month. So it is going to have its own timetable of, it is going to start shedding the lower anterior. So the front teeth is going to start falling at the age of 6 to 7 or 5.5 to 7. The back tooth or the molars are going to start falling at the age of anytime after 9 to 10. So it should serve the purpose of eating. So preferably start saving the tooth, see to that we are going to restore it, not going to just fill it up. Filling is just dumping it. Restoring is we are going to put it back in action, where the child is going to be able to bite and eat nicely, so that child is going to have a good normal common eating habit of both left and right. Otherwise, the child is going to eat on one side, then the development is going to be difficult, as well as there's going to be some amount of derangement of the occlusion, or the tooth is going to develop its own time. It is not that once the tooth falls off early, the next tooth is going to come off immediately. It has got its own timeline when it's supposed to come. It might be probably coming 2-3 months earlier or late, but because the tooth has fallen off, it is not going to come at the age of 6, means the birthday or the next day of the birthday, the next tooth is going to come. So it is going to take its own time. So, and it has got its own predilection of the age factor as well as genetic factor. Whether the child is having, the parents are going to have an early dentition or late dentition, all those things also comes into play. So that is why if the child is going to come regularly, then the acceptance as well as we will be able to take care of the teeth as such generally.
Okay. So, how does one prevent caries?
Preventing caries is the three things are there. As I told you how the cavity comes. One is tooth. We cannot afford to lose a tooth. The other one is food. We can't afford to be without eating. The thing is, we should see to that the food particles are not getting stuck more than about 20 minutes. So 90% of the time it is one brushing. The genetic predilection is there. They might be prone for caries, but if they are going to brush properly and be meticulous in maintaining it, 90% of the time we will be able to take care of it or preempt. We can at least reduce the intensity of the cavity. And if there is going to be a regular dental visit, and then educating, motivating the child as well as the parent. So if the education and motivation is going to be done for both the parent as well as the child, then we can very well prevent the cavity as such, or the difficulty of going through a painful dentition.
Thank you very much, Dr. Atman Prabhu. So, I think even if you have a genetic tendency towards caries teeth, the prevention is
we can postpone the inevitable or prevent the inevitable. We can just probably take it, and then avoid as much as possible, or the intensity can be coming down. Not that it should be having the same effect as that of the how the parents had difficulty in all those things. We not take it as a genetic relation that I also suffered, so that my child is also suffering. Probably because you have suffered, the mother or parent have suffered, we'll see to that the child does not suffer as much, or they have a much more pleasanter experience.
Thank you, Dr. Atman Prabhu. So, going forward to our last question, what about children having malaligned teeth and requiring braces? So, how does one address this? How do dentists address this? What should parents do?
Generally, if we are going to follow all the things what I've told for the last about 10-15 minutes time, we can probably preempt the problem of malalignment, or if the malalignment is going to come, we can probably reduce the intensity. One is sometimes it's a transitional one. Once the first two teeth are coming, the permanent teeth, and we might not see the lower anterior coming, we will just forget about it. But once the upper teeth comes, it is much more bigger. So, and there's going to be gap between. They think that it isn't malalignment. It is only a transitional malalignment. Once the lateral or the central incisors and the lateral incisors come, and the canine comes at the age of 11 to 12, then it is going to self-correct by itself. We call it as a self-correcting malocclusion. Only if it is going to go beyond the limit, we might need to go in for either removal appliance or a permanent appliance according to the time. So I will prefer to be waiting and watching and then doing it. There is no one solution for all malalignment. We can very well do it according to patient basis, or the child to child basis. We don't say it as patient. We are more of a healthy child, so that they are able to have a good dentition, so that they are able to have a good smile, as well as they are going to see to that the arrangement is much more pleasant, so that the confidence level, the psychological profile is also taken care of.
Thank you very much. Thank you very much, Dr. Atman Prabhu. So that really gives us a good picture of how we need to look after our children's teeth, and how regular dental visits may help to prevent many of these issues, and how regular care of the teeth will really go a long way in looking after giving children healthy teeth. Thank you very much. If parents and families, if you have any questions, please enter in the chat box. We will get back to you with the answers. Thank you very much.
Thank you. Have a nice day.
Yes.